Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer. Fertility expert Dr. Amy Abazadeh.
And you have yet another success story
Just launched by an East Bay fertility doctor.
Hi, everyone. Welcome to the Egg Whisperer Show. I am beyond excited to have thyroid expert Dr. Dr Maren on today's show. Hi, Christine.
Hi.
Thank you for joining us today. Fertility and thyroid is something that so many of my patients ask me about, so it is so great that I finally have an expert on my show.
I'm so happy to be here. It's one of my favorite things to talk about.
Excellent. So tell us why. Why is it one of your favorite things to talk about? Tell us about you, where patients can find you. Tell us more.
Yeah. So, thyroid is just near and dear to my heart. I'm a thyroid patient myself. So is my sister and my other sister and my mom and my mother-in-law and like so many other women I know, right? But besides my family, just so many patients. And really, I see people change their lives and change their families' lives when they get their thyroid treated the right way. I just think it's a big deal in terms of quality of life, really.
So you have a very personal story related to it, but tell us more about why you also went into medicine and what specialty you practice.
So that's kind of a blast from the past. I was a finance major. Little known fact about me. I graduated from the University of Colorado School of Business. And during that time, I studied abroad in Mexico. And I also did an honors program called President's Leadership Class. And both of those things just really instilled in me a sense of service. And as cliche as it sounds, I just really wanted to help people. My goal was just to find a profession where I was really helping people. And I remember sitting in finance class and my friend sat down next to me, and that time he opened the newspaper and he was reading about the stock market. And I was like, I could care less about that. And I was actually a group fitness instructor, and I was reading about health and fitness and nutrition, and I was just really into that. And I just kind of figured out I'm more into the sciences. I started taking organic chemistry and I loved it. Most people kind of dread that class, and I loved it. So I did my pre-med studies. I finished my finance degree, but I did my pre-med studies and then went on to med school. But I picked osteopathic school. I was really in this very holistic mindset, just sort of part of my upbringing. But I went to undergrad in Boulder and was sort of surrounded by acupuncture and Reiki and stuff. And so being just in this holistic mindset was just already part of me. But I also had hormonal struggles myself when I was in college. And the thing that helped me was acupuncture. So I already gravitated to this more sort of holistic path.
Yeah. And then where do you practice?
I practice in Colorado now. I actually am licensed in Colorado, Michigan, and Texas. So I have a virtual practice in all those states. Long story, but I went to med school in Chicago. My husband was a military doctor, and we traveled around because of that. But he's out of the military now, and we're settled in Colorado. So I'm back home.
That's great. And so you shared a little bit about having a personal connection to the thyroid. Do you also have a personal connection to fertility that you'd be willing to share?
Yeah. Much of my story really started with pregnancy struggles. So in residency, I had my first daughter. My husband and I actually got pregnant pretty easily, but I had a lot of weird complications that were unexpected. I had gestational diabetes, which was, kind of freaked me out. I really dove into nutrition at that point, was checking my blood sugar 4 times a day because I was really determined, I didn't want to go on medications and I wanted to have a healthy pregnancy, but I also just wondered what was going on. But fast forward a couple of years, my husband actually deployed and he came home and we were on a timeline. I was ready to have my second baby. And it took us a while to get pregnant. Not super long, it's like a 4-month kind of thing, longer than the first. And then I had a miscarriage. And I just really felt like my intuition told me there's something wrong with me. Something is going on. And it happened again. And at that point I was like, all right, I got to figure out, something's going on with my body. And indeed it was. That was my deep dive into functional medicine and sort of when my professional and personal lives collided, and I became a functional medicine patient. I, of course, saw a fertility doctor who was wonderful, but ultimately my diagnosis was unexplained infertility. And I felt like, well, there's got to be an explanation somewhere. part of that was definitely related to my thyroid, low progesterone. I mean, I used progesterone with that second pregnancy and had a son. And I got my health back after that. I mean, I worked really hard and I was feeling really good. And I was like cruising along, feeling awesome. And then I got surprise, baby number 3. So she's wonderful and I love her to death. But it's just that kind of testament to me. Like I tell my patients, when you get your health back, often your fertility comes back too. I mean, obviously there's a lot of factors there, right? But you know, underlying health is one of them.
Yeah, I agree. So let's talk a little bit more about fertility and the thyroid gland, but let's just start off with the basics. Can you just talk to us about the thyroid gland?
Yeah. So this thyroid gland is just a gland right here in your neck. I mean, it's a really important gland that produces thyroid hormone. And thyroid hormone controls a lot of things in our body. When we talk about fertility and hormones, it regulates ovulation. You know, for hypothyroid, we might not ovulate. It's also important with our periods. So people who have irregular periods might have problems with thyroid for that reason. But thyroid also regulates metabolism. So when we think about things like blood sugar, cholesterol, weight, thyroid's in charge of that. Also gut health. I talk about gut health all the time. And thyroid regulates your gut viscera. So your organs, like your intestines, I mean, this is why people with hypothyroidism are often constipated, but it's telling our body like gut motility and digestive enzymes and all that kind of thing. So it's just a really important gland that I think is sort of underappreciated sometimes.
Yeah. And what are some of the most common thyroid issues that you see? I mean, you did mention hypothyroidism.
Yeah.
What are some other ones?
Yeah, so hypothyroidism is the most common. And then the sort of reason for that is often Hashimoto's, which is an autoimmune disease, which causes a thyroid condition over time. So Hashimoto's is an immune system problem, but then over time can cause hypothyroidism. Not everybody I see, you know, some people are overtly hypothyroid and are identified by their primary care doctor because their TSH is very high and it's very obvious. But many people, it's less obvious. You know, their labs aren't super crazy and they might not be for a decade, but they're still struggling with hypothyroid type symptoms. So, and you know, sometimes, like I mentioned, that can be autoimmune in nature, but it can also be related to different nutrient deficiencies. Iodine's actually a player. I mean, that's a bit controversial, but you know, it is an important nutrient that affects our thyroid function.
Yeah. And then what are some of the symptoms of a thyroid disorder? You mentioned sometimes people are struggling. Can you describe the struggles that someone with a thyroid disorder might have?
So aside from infertility and irregular periods and constipation, it's like cold intolerance, this feeling of like cold to the bone, like you can't really warm up. A weight gain resistance. So not everybody with a thyroid disorder is overweight, but sometimes people can't lose weight because they have hypothyroidism. Hair loss, thinning hair, thinning of the outer third of the eyebrow, dry skin, sometimes muscle aches, depression, mood is a big one. Sometimes people also have episodic anxiety. What else? If somebody's wearing like a traceable, like I wear my Aura ring and can follow my heart rate, like you might have a slow heart rate or a low body temperature, which goes along with that cold intolerance. And just this overwhelming feeling of fatigue and exhaustion.
Wow. So if you're listening to us right now, now is the time to get out a paper and a pen. Because what I want you to do now, Christine, is just kind of talk to us about what tests should someone be sure to ask for from their doctors.
Yeah. So a TSH, that's what you're going to get. And I would always ask for a free T4 and a free T3. Now, a lot of people are resistant to a free T3, but I'll explain more. But I find that to be really helpful. I also like to look at a reverse T3. And I always order thyroid peroxidase and thyroglobulin antibodies, because if it is autoimmune in nature, that is a nice thing to know. I have a different approach when it is autoimmune than when it's not. And so, you know, in residency, in my conventional training, I ordered a TSH, and then I was taught to sometimes order a TSH with reflex. And that means if the TSH is abnormal, then you'll also get a free T4. But really, like normal for a TSH, there's a big gap there. There's, 0.5 to 4.5 are the general reference ranges for that. And many would argue that the upper limit of normal might be more like 2.5.
Got it. And I'd love to get into this a little bit in more detail. you mentioned something that I think people will wonder about is what is the difference between if you have the thyroid antibodies versus if you don't when it comes to management of your thyroid?
So this is my approach in functional medicine. Whenever there's an autoimmune disease, there's this triad that we know about. This is research from Alessio Fasano, but basically the triad of autoimmunity is a genetic predisposition, environmental trigger, intestinal permeability. So intestinal permeability is a big one. It has to do with gut health. It's often this sort of like leaky gut is like the name that sort of goes around. But like, if you really look and dive into the scientific literature, it's just about intestinal permeability. And often that's about underlying gut infections and gluten sensitivity.
Great. Well, thank you. So is there really a connection between thyroid and fertility? I mean, I know in your personal experience, you felt like there was, but I think so many patients go to their doctors and sometimes they get the eye roll. So tell us more about the facts related to that.
Yeah. So, well, as you know, when we're talking about the upper limit of normal for TSH, what's established in the literature is 4.5. But we'll give a little leeway when somebody's trying to get pregnant. And then the upper limit of normal is maybe 2.5, right? So we're like a little bit more strict about it when somebody's actually trying to get pregnant. And that's because your thyroid is such a big deal with not only getting pregnant, first of all, ovulating so that you can get pregnant, but also maintaining a healthy pregnancy. So yeah, I think there's a huge deal. And I think that a lot of people who are functionally hypothyroid aren't identified always, because if we just look at TSH, and we don't see what free T4 and free T3 are, those people get missed. So, I mean, I think at the very least, you got to ask for TSH, free T3, free T4, but know that you want to be in the upper limit of what's considered normal when we talk about free T4 and free T3, and in the lower range of what's considered normal when we talk about TSH.
So moving forward, I'll be adding free T3 to my panels, because right now I just do TSH and free T4. So thank you for your advice. And truly, just being in the normal range isn't enough. You want to look at the whole pattern. So
it's so true. And free T3 is really, it can fluctuate a lot. So check it. Timing is really important. So if you have a patient who is on thyroid medication, if it's levothyroxine, I like to check their labs before they take their medication. If it's like Armour or some natural desiccated thyroid, or even Cytomel, which is synthetic T3, I like to take their thyroid labs after they take their medication, between 4 to 6 hours. But that timing is everything when we're talking about free T3. Otherwise, it's like all over the map, and it's really hard to know what's going on. But if somebody's free T3 is like 2.5, 2.2, that's way too low. They should be in the 3s. It'll feel like they'll feel much better if they're in the 3s.
Super. Well, I hope this is helping a lot of people right now. And then what is the connection between thyroid and pregnancy?
Yeah, so in that first trimester, especially, it's really important to have optimal levels of thyroid function, especially T4. The fetus really needs to see optimal levels of T4, not so much T3. So it's a balance, but there's increased rates of miscarriage, and then throughout pregnancy, you can have increased complications like high blood pressure, preterm labor, pregnancy loss, basically. So,
and preconception, how long should a woman wait to try and conceive if, let's say, she's been diagnosed with hypothyroidism? Is just making sure your TSH is normal enough, or should there be a period of time where it's normal for a set number of weeks or months before she should try? What is your advice related to that?
I would say just get it normalized. I mean, if you're switching medication, your TSH is like going all over the place, like get on the right dose of medication, find out what your dose is, because as soon as you get pregnant, you're going to need to increase that dose by 30%. And it's really hard to know what dose to increase by 30% if you don't even know your dose at baseline. And it's a big deal for a successful pregnancy. So,
and how often do you recommend a woman get her levels checked if she's doing that, finding the right dose for her body?
So if she's pregnant, I would do it every 4 weeks. If she's trying to get pregnant, probably every 6. I mean, it takes TSH a bit to normalize. So if you switch your thyroid medicine and take it 2 weeks later, your TSH won't have adjusted yet. So 4 weeks at the minimum, probably 6 weeks.
Great. And then what happens postpartum? So after you've delivered a baby, what happens with thyroid function?
Yeah. So a lot of different things can affect thyroid function at that point. So number one, I think about is autoimmune. I like to screen all of my patients. I think every woman should really be screened for thyroid conditions postpartum. So autoimmunity is something we know is triggered by pregnancy. that is a huge risk factor, is having a baby. And so looking for any sign of Hashimoto's. But the other thing that can happen postpartum, and often this is like 4 months later, but postpartum thyroiditis, that might not be quite as common, but it's common. I mean, it happens. And so if somebody's like super anxious and they lose all their baby weight and like they can't sleep, even though they're super tired and they're hyperthyroid, it's because they have postpartum thyroiditis often, right? And then they tank and they're so tired and everybody's like, well, yeah, you're a new mom. I mean, of course you're tired, right? So we got to be aware of these things, I think, and screen and not, I mean, often many of the symptoms of hypothyroidism are the symptoms of pregnancy or being a new mom. Yeah, it's exhausting sometimes, right? It's tiring, but looking at those labs is simple and it's not super expensive. The other piece that I think about postpartum is just a lot of stress and sort of adrenal demand. So our HPA axis, that's our hypothalamus, pituitary, adrenal, thyroid gonad, HPA-TG axis, can really be influenced when we're waking up every 2 hours to breastfeed and all of this. So just really understanding like, okay, there's a lot of stress. Sometimes I'll use adaptogenic kind of supplements for postpartum. Also postpartum depletion. You know, there's a lot of nutrients that are a big deal with thyroid function. And so women might be struggling postpartum, maybe even postpartum depression. I mean, even the American Thyroid Association agrees we should screen everybody who has postpartum depression for thyroid disorders.
At what point should a woman have her thyroid checked after she's delivered to make sure that she's not dealing with postpartum thyroid issues?
Yeah, so my vote would be 6 weeks and 6 months, and then probably again at a year.
Perfect. So when you're diagnosed with something, I think sometimes people get worried that, number one, they should worry, and then number two, that they need to be on something for the rest of their life. I feel like that's the number one question I get asked. Like, now that I've been diagnosed with this, do I really have to take this for the rest of my life? And a lot of people don't want to. What kind of advice would you have for patients who are worried about that?
Yeah, I mean, I think it depends. Like, not everybody does have to be on it for the rest of their life, but often people do. And I think if you have some underlying autoimmune, you know, Hashimoto's that isn't addressed, yes, your dose is going to keep increasing if you never address the autoimmune component, because there will be continued destruction of the thyroid gland. But I think really, like, if you're on the right dose of thyroid hormone, it can be such a game changer in quality of life that most people don't want to go off of it after they realize, like, oh my gosh, it was like the lights turned on. You know, the depression is gone or lifted, or finally I can lose the 10 pounds that I haven't been able to lose, or my blood sugar looks better, or my cholesterol. I just think when you're managing thyroid, there are so many benefits to optimal thyroid function. And I always think about this risk-benefit ratio, right? So like, well, what are the risks? I mean, yeah, there's risks to managing somebody on too much medication. I mean, I'm not making my patients hyperthyroid though, right? So there's really very few risks. There's a lot of benefits. I mean, and what do we want? Like, I think, well, would I rather take a thyroid hormone, or would I rather take a cholesterol medication, blood sugar medication, and an antidepressant?
Oh, that's a great point for sure. So you mentioned your own thyroid journey, and you talked about something. You said, I worked really hard. So for people who want to know like what they can do that's in their control to improve their own thyroid function, what can you share with us about that?
Yeah. So I think, you know, nutrition and lifestyle goes a long way. Like, what does that mean? So in terms of nutrition, eating real whole foods, I'm gluten-free. I eat a lot of vegetables and a lot of plants. I mean, I eat more of maybe like a plant-based paleo style diet, if you want to put a name on it, but I'll have I mean, I'm not super strict about that, but I'm very strict about gluten-free and dairy-free. And I try to, you know, do low sugar. I mean, I still live, right? I try to preach balance, but I think for many people, especially those of us who have antibodies or autoimmune disease, it's really important to be gluten-free. And that really just goes for Hashimoto's, not necessarily somebody who just has, you know, suboptimal thyroid function, but really getting nutrient-dense foods. So your thyroid relies on things like iron and selenium and zinc and vitamin A. Exercise too improves your thyroid hormone receptor sensitivity. So all those things are a big deal. I think in terms of lifestyle, sleep's a huge issue. A lot of times what I see is what happens is your thyroid makes T4, the gland makes T4. It converts from T4 to T3 in your peripheral tissues, and some of it diverts to reverse T3. That's totally a normal thing our body does, but sometimes we divert a lot of it to reverse T3. And reverse T3 is like putting the brakes on, whereas free T3 is putting the gas on. And so when I see a ton of reverse T3, I'm thinking like high stress, you're not sleeping, inflammation, toxins, infections, all of this. So just that sort of healthy living is important. Also, just that low tox sort of lifestyle. I mean, if you're wanting to become a mom, you might be already keyed into this because it's important during pregnancy, of course, and it's important for fertility, and it's important for your baby. So really trying to get rid of some of the toxins that are in your home. I feel like the thyroid especially is sort of a magnet for that. So things like fluoride and chlorine and plastics and heavy metals, all of those can worsen thyroid function.
And everything that you have mentioned are the exact same things that I tell people that can improve embryo quality, right?
Awesome. Yes,
So
totally.
it can improve sperm and egg quality and thereby improve embryo quality. So very good advice to live by. The gluten-free aspect, I don't necessarily, I love how you said preach balance. There's certain patients where gluten-free is important and others where it may not be.
Yeah, and I think some people are probably better not going gluten-free, just some, but like sometimes what happens is people replace gluten with like rice flours and high sugar gluten-free stuff, like that stuff's not healthy. So, there's a balance. I mean, if you have autoimmunity, go gluten-free.
Right. Well, thank you so much for all your amazing thyroid advice. Can you just tell us a little bit more about where patients can, and people in general can find you? And you have a podcast. I'd love for you to talk about that as well.
So I have a new project launching called Hey Mommy. Mommy is MAMI. And so that we are on Instagram at heymommy.life, and we're launching a podcast and loved having you on as a guest. So we're super excited to launch that. It's going to be really good. And you can find me at Dr. Christine Maren on Instagram and on Facebook. I'm on Instagram a lot, and you'll find me there. My website's drchristinemaren.com, and all my clinical information's there.
Awesome. Well, thank you again.
Yes.
And thanks for joining us. And for everyone who's listening, I'm going to have her on for a live Q&A sometime very soon to answer your thyroid questions and any questions you might have for her related to functional medicine, anything that she might have talked about today. So stay tuned for that. Thanks, Christine. I'll see you soon.
All right. Bye.
Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer. Fertility expert Dr. Amy Abazadeh.
And you have yet another success story
Just launched by an East Bay fertility doctor.